It's been 2 years since the health care law was passed and signed into law. It's not getting exactly the same traction, though. People thought, I think, supporters, that as the law came, the first parts of it came to being, that it would gain more support and overcome some of the doubts.
Yeah, and as it turns out, it's neither here nor there. It's half and half. People love it or people hate it the same way they did when it was first introduced.
Let's go to Louise Radnofsky in Washington to talk a little bit about where things stand in the health care law and why opinion hasn't shifted dramatically one way or the other. Good morning, Louise.
Good morning.
So why do you think it is that opinion is sort of stuck where it is on this law?
For a lot of respondents in the polls, the law still seems to be a political issue, and they respond based on their political opinions. In fact, when people are feeling more generally sour with the Obama administration, the economy, and other issues, they also tend to feel more sour, just by a few percentage points, with the health care law. So it's still very much a political issue. But that isn't quite where Democrats hoped it would be at this point. They'd hoped that some of the early acting provisions in the law, those that kick in before 2014, would be things that people had experienced, and that those would change their opinions about the law, and they'd come to a more consumer-friendly perspective on it.
So what do you think has been the big success and the big failure so far for the law?
Well, as far as the administration is concerned, there are two really big successes. One is a provision that let adult children stay on their parents' plan up to the age of 26, and numbers for the number of people who are benefiting from that seem to have come in higher than expected. It's actually almost 2.5 million people. 2.5 million young people. And then the other number they point to is the number of seniors, around 5 million, who've had some sort of prescription drug rebate or discount in 2010 and 2011. Those are the folks who fell into the Medicare Part D donut hole.
How about some of the failures? What about the high-risk pools and pre-existing condition situations that you wrote about in your story? Are those programs and plans working out or not?
Well, there were a number of other provisions that didn't work out exactly as they'd intended. A long-term care program was canceled because it wasn't financially sustainable. They couldn't find a way to make it work. And with the case of the high-risk pools that we look at in the story, there were a number of people who were really interested in participating in them, but actually enrollment ended up being less than about a seventh of what it was originally predicted to be. For the folks who got in, they say it was a lifesaver, but they also note that the premiums are really high, and in other cases they don't imagine people will be able to afford them. Some of the folks we spoke to for this story said exactly that. They couldn't afford the premiums. Or there was another provision that stopped them from wanting to enroll in the high-risk pool. You had to have been uninsured for 6 months, and for some people that just wasn't an option.
Right. Louise, clearly one of the tough things about this is that being able to weigh the benefits of this act, or if it's not doing its job, it's going to be years away from seeing when the really big things kick in. And in the meantime, is there any way to disentangle the politics from an assessment of this?
Probably not next week when the Supreme Court reviews several of those very big issues, but you're right to note that in January 2014, that's when the really big stuff happens. The mandate, for example, the requirement that people carry insurance or pay a fee, which is hugely unpopular and probably is one of the reasons that people feel as negatively as they do about the law as a whole. The other things that are likely to start in 2014, assuming there is an action at the Supreme Court that prevents that from going ahead, is Medicaid expansion, subsidies for people to start buying insurance on exchanges, and all of that will kick in depending on what the Supreme Court decides to do.
Right. Okay. And Louise, as you say, a lot's going to hinge next week and in the weeks after on what the Supreme Court ultimately decides about that individual mandate.